Good afternoon. It's Thursday, September 17th, and we thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. Joining us at the table today is the Honourable John Hagee, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly. Will begin shortly.
Good afternoon and welcome to our weekly COVID-19 briefing. As is customary, I'll turn things over to Dr. Fitzgerald, our Chief Medical Officer of Health.
Thank you, Minister. Good afternoon, everyone, and thanks for joining us today. Since the media advisory yesterday, we have no new cases of COVID-19 in the province, and the total number of cases stays at 271. 267 people have now recovered, and in total we have tested 36,596 people. On March 18th, 2020, the Minister of Health and Community Services, on my advice, declared the province's first public health emergency under the Public Health Protection and Promotion Act. And at that time, the World Health Organization had just days before declared COVID-19 a pandemic. What transpired in the days, weeks, and months that followed has been nothing like we've experienced before. With so much unknown about the virus at that time, swift action required us to rely on public health principles and trust in the support and actions of the people in the province. And we have navigated through the unknowns of this virus together, and we will continue to do so. This week marks 6 months since the declaration was first issued in the province, and a lot has changed since that time, and while questions still remain about this virus, the global community has learned a lot about COVID-19. In this province, we have learned from our own experience managing a large outbreak and from the experience of other provinces across Canada and from countries abroad. These lessons have informed our actions and public health advice. The public health measures we've put in place throughout the last number of months have served us well in times of great uncertainty. Change at the best of times is challenging, but the rapid pace of change we've gone through with COVID-19 has been nothing short of remarkable. We've met many milestones, and we are now learning to live with COVID-19. In May, we started to take steps to safely reopen our economy, and this has continued through the summer as we all adapted to our new circumstances. These steps were supported by public health measures requiring travelers to self-isolate upon arrival, limiting non-essential travel into the province, and requiring people to wear masks in public spaces. This month, our children and youth were supported to go back to school, another important milestone, after months of being away from in-person classes. Ensuring our kids have the best start in life is critical to their long-term healthy development. Protecting them against any unintended impacts of this pandemic must be top of mind, and it takes our collective actions to ensure they are safe, healthy, and happy. One thing that has stayed the same with back to school, however, is the circulation of illnesses similar to the common cold. But obviously this year there are challenges with this certainty. Right now, we are seeing a virus called enterovirus circulating in some areas of the province, which is causing some concern for parents. Enterovirus is an illness with symptoms similar to the common cold, and many of which are also similar to COVID-19. When it comes to your child, please follow the guidelines we have set out for back to school. This information is available on our website at gov.nl.ca/COVID-19. If your child is experiencing 2 or more symptoms and you are concerned, please call 811 for further guidance or complete the self-assessment tool online. While we are still coping with some of the changes brought about by the virus, the summer season brought with it a much-needed sense of reprieve. It allowed us to socialize safely outdoors and enjoy the good weather that came with the season. Now on the minds of many is what will happen as the weather grows colder and more activities move indoors. And we have seen in other provinces an increase in cases, particularly among young people. For our youth, I want to remind you that it is important to continue to follow our public health guidance of practicing good hand hygiene, maintaining physical distance, and wearing a non-medical mask in public spaces. This includes time spent outside of school, such as during after-school activities and during lunch periods where you may leave the school grounds. And while our numbers right now are low across the province, we have seen how quickly this virus can spread, so we must remain vigilant. And I know you're all up for the task. While we have been grappling with COVID-19, we must not forget that influenza is still a concern for our communities and our healthcare system. This year it will be more important than ever to get a flu shot. We need our health system to have the capacity to deal with the surge of COVID-19 cases, and keeping flu out of our communities is one of the most important ways to do so. Getting the flu shot is one of the most important ways to reduce the spread of flu in our communities, schools, and health system. We have asked you to do many things to reduce the spread of this virus, and you have all risen to that challenge. We are now asking that you get the flu shot to help in the continued fight against COVID-19. Our flu clinics will be up and running in late October as usual. We will have more information in the coming weeks about how to get yours. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 271. As we enter into the last quarter of 2020, with your help, your perseverance, and your patience, we will meet more Life with COVID-19 milestones together. Thank you.
Thank you very much, Dr. Fitzgerald. Yes, good. No new cases again today. We have one active case in the province. We're on day 194. It's been a long road, and it's still not over yet. This is a marathon. I would argue a marathon with hurdles. It's not a sprint, and we need to bear that in mind. The province has done very well over the course of the pandemic. The numbers have remained low, and the Atlantic bubble has had similar success. Joining the Atlantic bubble has not had any appreciable downside to the COVID issue. And indeed, I think now other jurisdictions in Canada and possibly even around the world are looking at Newfoundland and Labrador and the Atlantic bubble to see what it is that we've been able to do and how we've been able to do it to bring these numbers down to a level that we can manage without too much in the way of challenge to our healthcare system itself. What we said at the beginning was that it was going to be fairly straightforward to close things down, but it was going to be a lot more difficult as we balanced the risk to the population health with the inconvenience and the challenges that we presented to individuals and their economic well-being. We still walk that fine line. You look across at other provinces, and British Columbia, Alberta, Ontario, and Quebec are all seeing significant challenges with further waves or clusters of cases. And whatever we do within Newfoundland and Labrador and the Atlantic bubble has to bear that context in mind when we look at making further decisions about easing and opening things up. The holy grail for COVID-19 seems to be a vaccine that is safe, widely available, uptake that is popular and that works. That is as yet nowhere near available and nowhere near ready. And I think the best estimates would suggest next year and possibly even the end of next year before that is available. Similarly, we don't have a specific treatment for COVID-19 as an infection. There are promising therapies, but they are by and large effective with smaller groups. So to build on what Dr. Fitzgerald said, this time of the year is normally when we would see our planning for the flu and how to deal with it. Those plans are there. In conjunction with extra testing sites, for example, for COVID-19, because of the confusion that this will bring over the course of the winter season. We have plans. There are really only so many ways you can do mass vaccinations. So the question of the granular detail of where those sites will be, what times they will be open, are all nearly ready, and they will be available in advance of the back end of October when the flu clinics will start up. In advance of that, however, we will be taking the opportunity to protect those citizens who are the most vulnerable. So we will be going into personal care homes and long-term care homes to vaccinate. We will be offering it in schools. And in actual fact, we would like to try, if we can, to make the school vaccinations family events for better uptake. Those plans will be coming out very shortly, and they will roll out in advance of the regular public mass clinics. Those plans, in terms of who will go where and when, will be announced with plenty of notice so that as many people as can be accommodated can be accommodated. This year, the difference will be that we'll have to look at the density of people so that we don't involve a lack of physical distancing to make sure that people are crowded and it causes more problems than it solves. Similarly, we will be looking to basically anyone whose scope of practice allows them to give flu shots to be able to do that. And the question of who those will be and when and how, those are all operational issues for the regional health authorities, and they will be solved by the back end of October. I would encourage you to keep an eye open. There will be a media campaign advertising flu, and there will be local targeted advertising to explain where and how you can go and get your flu shots. This year it will be crucial. We have got federal support for flu vaccines for the seniors, and we have bought enough flu vaccine for everybody. The other thing I'd just like to touch on before I hand it back to Ms. Dix-Payton was brought up really in some highlight yesterday at the rally I attended on steps of Confederation Building. Listening to some of the speakers there from the oil and gas sector, it is obvious that they are under considerable stress and strain. And whilst other departments in government are working to get the federal government to come forth with their support for the oil and gas sector, from our point of view in health and community services, we do have a broad range of mental health supports. These can be accessed through Bridge the Gap, but they can also be accessed in a more traditional or direct way if that's your preference. So doorways clinics are open. Bridge the Gap allows you to access therapy and services online, which won't necessarily be solely online. There's a whole suite of programs and a whole range of activity from simple self-help, stress management and meditation kind of approaches, all the way through therapist online to face-to-face and counseling. And I would encourage anybody who feels the need of something like that to take it up. We have made significant strides towards recovery in the last 18 months on access. Those services are there for you. They are ready, and they've been regarded throughout the pandemic as emergency services by the department. So please don't feel you're alone. And certainly from our point of view, if there are people who have challenges that can't be met that way, then please feel free to reach out to your primary care providers as well. So with that, really, I'll finish today. Thank you for your time, and I'll hand it back to Ms. Dix-Payton.
Thank you, Minister. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask one question and one follow-up. If time permits, there will be an opportunity to ask further questions. We suggest that you do not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed towards the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Dr. Fitzgerald, it was noted today that the travel ban that was in Supreme Court of Newfoundland and Labrador was won by the province. And Minister of Health, John Hagee, beside you, noted that in the scrum afterwards that it would be up to public health to determine how long the travel ban would remain in place. Do you have any indications on a timeline for this?
No, we haven't had any discussions with regard to a timeline. At the moment, the travel restrictions will remain in place. We're, as I've said many times before, we're constantly looking at the epidemiology here and elsewhere, with regard to this, most importantly elsewhere, and that determines our decision on that.
Thank you. There's also been some confusion in terms of back to school and flu-like symptoms, COVID symptoms, many kids being sent home after one symptom. Wondering if it needs to be 2, and how do you know when your child can go back to school? Do they have to go and get a test, or how is that working?
So certainly at the moment, our screening tool asks for 2 or more new or worsening symptoms. So if this is a symptom that your child routinely has because they have allergies or they have a cough because they have asthma, and that's something that they routinely have, then that's not really what we're talking about. It's new or suddenly worsening symptoms. So 2 of those, then they should stay home. And what we've recommended is that they need to stay home until 24 hours after their symptoms have resolved. Many people will contact 811 or do the self-assessment through 811 and be advised to get a test done. That may be, they may have the results of that test back by the time they go back to school, but it's certainly 24 hours after symptoms resolve.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Thank you. Minister Haggie, you mentioned that, it may be this time next year before we have a vaccine in place. How sustainable is the travel ban that we have in place right now, both economically and socially? Because there have been a lot of people who have faced some substantial negative impacts by not being allowed. In fact, including the 3,000 or so people who've been denied the exemptions to be able to enter the province.
No, and there's no doubt it is a challenge. It wasn't something that under any other circumstances we would have even contemplated doing. So, having said that, there have been well over 17,000 people who have actually got into the province. It could actually be, I think, 20,000 on today's figures who were allowed in on travel exemptions. So there is travel in and out. From the point of view of the economy, the lockdown, according to economists, is not the cause of the economic downturn. COVID-19 and its effects directly on people's behavior seems to have been as much of a driver as any particular reaction to it. I think the facts of the case is that from my point of view as a Minister of Health and Community Services, my prime responsibility is to ensure the health and safety of Newfoundlanders and Labradorians. I accept that there are downsides to some of the measures that we've got, and a lot of these are economic. And we, as a government, cabinet of which I'm a member, it's top of mind as to how to continue to allow as much normal business activity as possible. But there are limits because of the nature of the disease. It's a balance, and it's a line we try and walk. And I'm sure there are as many people think we get it wrong as get it right.
And to follow up for both you and Dr. Fitzgerald, if you look at the way the ban's implemented right now, it's a fairly blunt instrument. So, for example, if you are from the Northwest Territories, you're not allowed in, despite the fact that there are no active cases there. And if they did get in, they would have to isolate for 14 days. When you look at European countries, they've set various thresholds for prevalence. So if a country goes above that, quarantine measures are in place. Goes below that, quarantine is relaxed. Some also have required testing, for example. Why don't we have a more adaptive system that would allow us to address the higher risks while giving more freedoms to people who may be coming from lower risk areas?
So I think, those are good questions. They're not just simple to implement, and takes a lot of thought and a lot of organization to do that. So certainly, there are some limitations to how flexible you can be. Going forward, those are things that we have to consider, and we've always said that we'll try to be as flexible as we can. So, as we move forward, certainly we'll look at all of those factors in making our decisions.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. Minister Haggie, you said a week or so ago that the province can't change the conditions of Federal Quarantine Act, but it can add its own restrictions. What, if any, restrictions has the province added to international work?
From the point of view of adding, we have tried to align ourselves as far as possible. And I think I would kind of flip that round and say, do you have a specific example of where that has happened? Because my understanding now is that I can't immediately think of one where we're terribly offside with the feds.
Okay, well, the Quarantine Act exemption, it seems to allow essential workers from out of the country to be in public as long as they wear a mask. So is that different here?
From the point of view of our essential workers, we require that they self-isolate when they're not at work. They can be out in public on the way to and from work, but they do have to be masked and maintain physical distancing.
Okay, thank you.
Our next questions are from Linda Swain of BOCM News. Please go ahead.
Hi there. You mentioned just previously that flu vaccines will be offered in the school system. What about COVID testing?
COVID testing at the moment is done through a targeted approach. So the screening tool is used to identify those people who have a clinical need for it. One of the discussions last night at the Health Minister's federal, provincial, territorial discussion was where Health Canada was around rapid testing. There has been no movement there that we can detect in terms of kits and boxes and things being licensed. So until that changes, the most effective and efficient route, in our view, for the use of COVID testing in schools is the one we're following at the moment.
What about the Janeway Hospital? Is there or will there be a testing site set up there?
There is one. My understanding is it's actually operational today. It's a drive-through. Now, I may misspeak because they were in the process of constructing it the other day, and I was told it would be 48 hours. So if it's not up and running yet, it will be very shortly.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hello. Wondering about the phone booking system for COVID tests. Can you talk about the specific changes that have been made to increase capacity? So, and I want you to touch on three things if you can. How many people have been added? How much have hours changed, and is there more staff on at a time? Can you give some concrete info on that stuff?
I can give you some. Those people who are directed to a public health booking line, and this is in Eastern Health because there hasn't been issues in Western, Central or Labrador Grenfell. But in Eastern Health, their targets are no longer a wait than 30 minutes and 48 hours from call to getting the test done. A snapshot yesterday afternoon, for example, revealed average wait of 4 minutes. I couldn't give you what the average wait is for the test, but those are the benchmarks we've given Eastern Health. I do know they've altered their phone system, and I do know that they've increased staffing. To what level, you would have to ask them. From my point of view, it's a performance-related issue. They have their benchmarks and whatever it takes to meet them.
Patrick, do you have another question?
I do. Sorry, I muted myself. Why is it necessary to have an appointment system in place for people to go get tested?
The appointment system is designed to make sure that we don't have large clusters of individuals in the same space at the same time. It goes back to Dr. Fitzgerald's mantra about people, space, time and place. This has been the most effective and efficient way to do it up to date. And the challenges around the scheduling have really been around Eastern Health. They've been around the booking issue. And I'm sure that we'll need to reopen some of their mothball sites to cope with the increased demand. But those are operational issues for Eastern Health to manage. The other three RHAs have done very well.
We'll now go through a round two of questioning, starting with Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm wondering about masks in school. We know that for 7 to 12, they were to be mandatory if 1 meter distance couldn't be maintained. You know, for the younger grades, once they were in the classrooms, their cohorts would remain the same, and so their masks would be removed there. But the common areas, as far as I had understood, were where masks would be worn, but I'm hearing many schools aren't following that, just looking for clarification.
I'm sorry, Kellyanne, you said the common areas, and I missed what you said after that?
Oh, sorry, that's in the younger grades, masks aren't being worn in the common areas. That's what I'm hearing from several schools or from several parents with children in those schools. Just looking for the clarification on when masks need to be worn for kids under the grade of 7.
So the public health guidance for mask wearing for younger children are on the bus, and once they get to their classroom, then they can take their mask off. And then when they're going back on the bus in the afternoon, they put their mask on before they leave their classroom, and they keep it on until they get home. So there is no requirement for children to wear masks in the common areas of the lower grades. Presumably, the schools will be able to manage classroom flow such that classrooms, when they're moving through the corridors, won't come into contact with each other, and physical distancing will be able to be maintained. So there's no requirement for masks in the younger grades in the common areas from a public health point of view. However, you know, what schools do or the school district does in terms of their policies, that's a different question.
Thank you, appreciate that. I'm just looking to see if we have an update on how the rotational workers change has gone to this point, knowing that we're almost 10 days into it here at this point when they could have increased their testing. If you are liking the results of it so far, or your feelings on it?
Well, so far it's been promising. I think it's you know, we haven't had any major surprises, but the full evaluation won't be done until the end. So and you know, we've left that to a separate entity to do so.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Thank you. Minister Haggie, you mentioned that you're not aware of any situations where the rules in this province are more strict than the federal rules when it comes to international workers. I can give you a couple of examples. So, for example, those who work on board Great Lakes freighters or aircraft mechanics who may have to travel internationally, they're being told by 811 that they can't get the shorter one-week isolation because of the federal rules. I talked to Transport Canada. They told me that those workers are considered essential, so they are exempt from any quarantining that is required when they return from an international trip. So why is this testing and shorter isolation not available to them, considering the federal government does not require them to isolate?
I think there's a communication issue here. I checked up on Great Lakes boats, particularly in the light of comments. There is the concept of what's called a closed vessel. So that's a vessel whose crew do not leave the ship and who do not have anybody visiting the ship, with the exception, for example, of a harbour pilot or a safety-related issue. If you are on a closed vessel and you depart and return to a port within the Atlantic bubble, there is no requirement for you to self-isolate. If you are someone who's gone to a US port, for example, and you return home by commercial airline from a point of departure outside the Atlantic bubble, you are regarded as a rotational worker. You should call 811 and you can have the COVID test between day 5 and 7. And if that is negative, then after day 7, you're good to go.
When was that change made? Because the workers that I've been speaking to were told by 811 that they do not qualify for that testing.
The information I have is that's been there for a little while, so I'm looking into how those dates match up. I can't give you the answer.
Okay, thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
I just wanted to ask Dr. Fitzgerald about the recent court cases. And I'm wondering whether that particular case, either in while it was going on and now with the decision, if that has had any influence whatsoever on the public health decisions that you've been making.
No, public health decisions have always been based on the evidence, based on best practice, looking at epidemiology. The court case was not a factor in any of the decisions that we made.
And there is still another case pending. How likely that is to succeed in this case is up in the air. But are there any specific contingency plans you would have if, for example, an appeal ruled against the ban?
So I guess we'll cross that bridge when we come to it, but we'll continue on with all the other public health measures that we've had in place, and we'll make sure that our public health capacity is ready to respond, and we'll do what we have to do. But at the moment, we're not there, and we're not. We're going to continue on as we've been doing.
Our next questions are from Linda Swain of VOCM News. Please go ahead.
What solutions have you found to the issues faced by the overloaded 811 system last week?
811 was, and I'm speaking particularly of the health line element of 811. 811 experienced a surge. It took them a couple of days to get their staffing adjusted. My understanding there is that their callback times, so urgent callback is 0, and the maximum callback for an information call as of yesterday was the order of 65 minutes. The wait time actually to get the phone answered, I couldn't give you what today's figures are, I haven't seen them, but again, a snapshot yesterday, it was of the order of 5 to 10 minutes.
And have there been any changes or any changes considered to hospital visitation?
No, none further at the moment.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi again. Dr. Haggie, you're talking about the reason why you're going to have an appointment system in place because of people's space, time, and place. But if we're going with all drive-through clinics right now, people within their vehicles, why would that be an issue in that circumstance?
Well, that could be a traffic management issue, and I wouldn't like to opine on that, but having seen the lineups at Tim Hortons in Gander, it's very dangerous. The facts of the case are this is a system that is working for us. It lends predictability to people who have families, who have work commitments, that they're juggling to try and get these tests done for their children or their spouses or their senior loved one. So there are those kind of elements in the decision too. But at the end of the day, this system has worked and we haven't had significant challenges with it. If we get those kind of challenges and it looks like there's a better way of doing it, then we'll look at that for sure, because that's what we're interested in, is getting it done properly and quickly.
Dr. Aggie, just on the amount of time people have to wait to get a test, it seems like a key problem in the sort of chain of booking is when you're given a number, you're referred from 811, given a number to call Eastern Health, and at that point in the chain, when people aren't actually able to get through is where there's a lot of difficulty. And there aren't, I guess it would be difficult for Eastern Health to be able to actually give a number, a wait time for that, because people aren't already in a queue at that point. That point in the chain where there seems to be a lot of issues, is that being looked at specifically by 811 and by Eastern Health? Can you tell us anything about that?
Yes, for sure. You can actually measure the call waiting. Telecom engineers have been working with Eastern Health to provide them with a call center style of approach. And that has resulted in significant improvement. Again, these are operational issues, but effectively they've gone from the situation you described, which was certainly the case over the weekend, last weekend, to wait times of anywhere from 4 minutes, which was the snapshot I was given yesterday. I don't have average data for today. Eastern Health are supplying that, but they've been given clear performance targets by the department. How they get to those performance targets is down to Eastern Health and the telecom provider. And
just one other thing, during rotational workers currently are allowed to leave during quarantine. They can go on a bike ride or a walk or a drive as long as they go by themselves. Are there any thoughts about broadening that to other people who are in quarantine, given the risk is I guess, reduced?
Not at the moment. We're trying to keep quarantine regulations the same, whether somebody's coming in under federal quarantine or provincial quarantine, just to avoid mixed messaging. So at the moment, no, we're not considering that.
Thank you, Dr. Fitzgerald. Kellyanne Roberts, do you have any further questions?
I just have one final question. We've talked extensively or asked extensively about the travel ban and the case that ruling was just decided on. I'm just wondering, in terms of the Canadian travel bubble, have there been any further talks on that?
The travel bubble, sorry, you're a bit muted there, Kellyanne. We haven't had any discussions on altering our travel bubble, if you're referring to the Atlantic bubble, or broadening it more widely to a Canadian bubble.
That's exactly what I was asking. Thank you.
Peter Cowan, do you have any further questions?
Yes, I have a couple more questions. About testing time, I talked to one parent who called 811 on Sunday and still hasn't received that final call back with an actual appointment in order to get tested. So can you explain why that seems to be different than that 48-hour standard that you're talking about? And also explain, why does it take 3 different phone calls in order to get one test booked?
The process is that it should really take only 2 phone calls. That's what we're working to. One to 811 to see if you need the test, and the other one to the regional health authority to organize the test. I can't speak to a specific there, but obviously there's a significant issue. Having said that, the issue on Sunday was, among other things, lower staffing levels on the public health booking line in Eastern Health. I appreciate the frustration, Peter, but the situation today is significantly different than it was at the weekend. If there is any delay beyond 48 hours between call and test through Eastern Health, I haven't yet been made aware of that, and I'll certainly go back and ask the questions after this.
With all these kids that are developing sniffles right now, whether or not it's cold or enterovirus or whatever, considering the fact that we haven't seen any community spread since April, if a student has the sniffles, they haven't traveled, they haven't been in contact with someone who's traveled or someone who has the disease, why are we putting them through the stress and discomfort of testing when we know, based on the epidemiology right now, the odds of them having COVID is extremely low?
So that is true. However, we don't know that there's no COVID out there, and not everybody knows everybody they've come into contact with over the past 2 weeks. So we are trying to keep COVID out of our communities the best way we know how, and that is to test people who are symptomatic. This is pretty consistent across the country right now, I don't know that any of us want to find a case of COVID from a person who presents to the hospital that's a result of community spread. That's not really the way we want to find out about a resurgence of COVID in the province.
And my final question is, we heard about a month ago that we were going to know kind of the timeline for alert level 1 and what that might look like in the next 3 to 4 weeks. So I'm just looking for an update on that.
So alert level 1 is, we're not anywhere close to alert level 1. What we're talking about with that would be, a significant reduction in COVID spread, not just here in the province, but in the country and perhaps around the world. We're not, much of the world is still seeing increases in COVID in their epidemiology, and I don't think we're anywhere close to looking at moving into a level 1 where we would, consider larger mass gatherings or consider more travel or things like that. We're certainly not there at this point.
Thank you.
Peter Jackson, do you have any further questions?
Yes, I do. I just wanted to clarify something about the phone line transplant. You're saying it's no longer than 30-minute wait, and then no longer than 48 hours to get the test done, or 48 hours to get the test back. Because if if you go at day 5, it takes 48 hours just to get the test and another 48 to get it back. You could be looking at waiting for 9 days.
Yeah, the the benchmark test, the benchmark that we have given Eastern Health are the ones I have given you. In terms of public health, the issue of how fast negative tests particularly get uploaded is really the issue, and certainly that's one of the discussions that staff were having yesterday with Eastern Health, Public Health Lab really. The positive tests we get notified of the minute they come off the run. There is, with the exception of geography, very little delay in getting the test result back when it's positive. The runs are done at least twice a day. The main delay is in getting the specimen to St. John's if you are outside of town.
Okay, thank you.
Do you have any further questions, Peter?
No, that's great, thank you.
Okay, Linda Swain.
I'm good, thanks.
Patrick Butler.
I've got one more, again related to the phone line. The government has created a new ministry for digital government. These phone lines are taking a lot of resources. Has there been any consideration given to creating an online booking system so that you wouldn't have as many public health nurses that were involved in this process?
We have, with Eastern Health, a pilot scheme for online booking, which has really only gone live in the last 6 weeks. Once that has been evaluated, because there have been some teething problems with that, then, if that serves the purpose, it would then simply be a question of expanding that. This would be one area where that would happen. This is not necessarily digital governance and Service NL issue as much as it is it's a regional health authority issue, an NLCHI issue. Currently, the only iteration of our online booking within the RHA structure is with Eastern Health.
Thank you.
Thank you very much. Minister, did you have any concluding remarks before we ended today's news event?
No, thank you very much. Thanks everyone for their interest, and I hope they found this helpful.
Thank you so much for tuning in. Please join us again on Wednesday, September 23rd at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.